That was an excellent talk, Dr. Rutuja. Thank you so much for being with us. So mine is the last one. I'll be try to finish as quick as possible because time is very less time we have. So I'll be talking about journey of a cataract and a refractive surgeon. So I'm currently practice as a cornea, cataract and refractive surgeon at SRJ Netralaya, Indore. So nowadays the cataract surgery itself is a refractive surgery, and so many I have got questions by younger generations that is a cataract surgery refractive surgery too. Obviously yes, because now we have very advanced intraocular lenses, and the patients demands are also getting higher and higher, and people who are going for LASIK, and they also in future coming with cataract, and they also still don't want to wear reading glasses even for after cataract surgery. So the patient demands are also becoming higher, and awareness is also becoming. So with these newer advanced lenses, obviously we have option of removing glasses for the patients, and for that you need to be good at it. So perks of a cataract refractive surgeon, it is, as many of my friends told, that it is a main bread and butter for all of us. Almost all of your patients are happy after the surgery. There will be patients who are not happy even after giving 6/6 and N6 vision, but that is also another topic to talk about, unhappy patients. And basically it is the maximum volume of your practice. So as being a refractive surgeon or a cataract surgeon nowadays, the cataract refractive surgeon I would call, there is a very small margin of error, and you need to have high precision and high accuracy starting from preoperative management, and that starts with the biometry of our intraocular lens, or in case of refractive surgery, about corneal topography and getting the correct refraction before you plan LASIK surgery. So let me just quickly tell you about myself. I'm a doctor. I did my UG and PG from BJMC Ahmedabad. Then I went for postgraduate DNB at Narayan Netralaya, Bangalore, following which I did cataract as well as cornea fellowship from RIOC, Sitapur, and I continued there as a consultant, following which I did a short refractive training. So what are the pathways to become a good cataract surgeon? So there is no single pathway for this, right? Where so many people ask me about that, whether to go for fellowship or whether to join a charitable hospital where you get a lot of hands-on cases. So it is important you have to decide according to your personal situation, as well as financial background, as well as multiple other things where you want to practice and stuff. But wherever you go, important thing is to learn, whether it be it your fellowship, whether you are directly joining a charitable setup. But important thing is you need to have a mentor who can help you when you are in a trouble, and you need to, because see, when you are learning, you are going to make mistakes. You are going to make mistakes, and those mistakes are the very good teacher for you, right? And important thing is to focus on your basics during the PG. So I've seen that even during my PG, that many of my friends were running after surgical numbers, and they wanted to do more and more surgeries. So and they were missing out on learning about basics, learning about clinical diseases, clinical pathologies, learning about anatomy and stuff. So your foundation has to be strong, so that helps you all throughout your career in the future. And important thing is never run after surgical numbers, because they are just numbers. First improve your skills, your numbers will automatically improve. When I was also learning, I never looked at my numbers. First I started to improve my surgeries. Once my surgeries was taking lesser and lesser times, my number started increasing. When I started phaco, I reached topical phaco level in just 2 months. Not to brag about it, but I was not even aiming for that. But I got it as a gift when I was focusing on just learning. I also got a chance to train other people as a surgical trainer for 1.5 years, and I also did cornea fellowship at RIO. So what are the challenges as a cataract surgeon? This is what I have learned, that even from my journey, as well as the people whom I have trained, many of them, they want to do surgeries, but they don't understand biometry itself. So the important thing is to know about biometry, understanding different IOLs, understanding the phaco dynamics before you sit with a phaco machine. That is the most important thing I would believe anybody would has to know about that. Then you understand your surgical steps, and find out what kind of mistakes you are having in your surgical steps. And ultimate goal, obviously, because of the demand, as a whenever you go for a job, that can you do a topical phaco, that is the question being asked for anyone who is jumping out for and starting their career. And last thing is, this is my personal belief, that if you know how to manage your complications, then you're ready for your prior practice. right? So most common mistakes I have seen during learning phaco is the sizing of the capsular axis. So many people end up with a small size capsular axis or even larger size capsular axis. Another common mistake is a bad and leaky incisions, which I have faced a lot during my learning period. Wrong phaco parameters during when you are starting. I mean, in a harder cataract, if you keep your power very low, I mean, it's not going to break. There is a basic thing, but even when you don't know phaco dynamics and stuff, you will make these mistakes. I also struggled with chopping and then gradually improved. I have a video on that on my YouTube channel. Another most common mistake is unfortunately many of my students also face this, that they were not able to detect or identify posterior capsular rent when they're doing surgery, and they still continued with the surgery and ended up making even a bigger complication. So these things are very important. You need to learn to use retro illumination of the microscope, which helps to detect the PCR, understand that there is something wrong in the anterior chamber when the PCR happens, right? So this is another just for viewers who will be watching this IC on YouTube, and I'm sharing this, that I have a video on phaco settings and parameter on my YouTube channel. You can check this out later. This is a case where I am sharing of my own surgical case. I have 1 minute. So you can see, before I started my surgery, you can see there will be so much of anterior chamber fluctuation visible, that is showing that my ports are quite leaky. And during this surgery, you'll be seeing that the iris was also floppy in this case. Sorry. Yeah, sorry. And when I removed my irrigation and my chopper, the iris was coming out of the ports. I tried to reposit it with the visco. It was still again coming out. The anterior chamber was not that shallow, and there was no any signs of rock hard eye in this case, but my incisions were really bad, and during the whole surgery the iris was out of the port, and at the end I had to suture this port. So this is the most common mistake we make while learning. Failed chopping is another thing I also faced during my learning phaco days, and the holding was not proper with the phaco prop. The vacuum was not good enough. Sometimes the chopper movement was not correct, and these all the things. Then I made few modifications, that I started taking a pause when I was holding the nucleus before even moving my left hand, and I improved the location of the tip of the chopper entry point, and that helped me to improve my chopping skills, and gradually I was able to get to the level where I wanted to reach. And you can see this is the case of mature cataract, where the beautiful chops are happening. Another difficulty we face is this surge. You need to understand surge when sudden there is a break of occlusion, and I'm catching the posterior capsule in this case while eating up the last piece. Is a case of shallow anterior chamber with non-dilating pupil. I was using IREX look. So this is another thing which we need to avoid. So only way to improve is learn from your mistakes. I also wanted to learn refractive surgeries, which I learned after learning about cataract and cornea. So I again went back to Narayan Netralaya and Dr. Rohit Shetty sir and Dr. Pooja Khamar, who helped me a lot with my refractive journey. Important thing is to understand your machine. We have Alcon Wavelight EX500 at our center, and it is important to know your machine, because your machine also will have some fallacies. There will be a chances of undercorrection or overcorrection, and you need to know that what kind of results you are getting with your machine, and according to that you can proceed further. And always start with the wet lab. Record your surgeries is another important thing to learn. I always record my surgeries. I'm very fond of it. Even I have recorded my LASIK and PRK surgeries and certain other surgeries as well, which helps you to teach yourself to improve your mistakes. There are after you learn basics about surgery, you will make minor mistakes, and which only you can improve if you can identify them by looking at your surgeries later. So just to share, I have a YouTube channel where I'm putting surgical teaching videos for all young eye surgeons out there, and you can check it out. And there are so many videos there. And it is also important to have fun in life, because work-life balance is the most difficult thing to achieve for anybody. And all of my presenters are there in one of the photographs here. I am very grateful to have such good friends. People, if anybody wants to connect with me for any questions later regarding any guidance, these are my contact details for anybody who will be watching this on YouTube as well. Thank you so much.